Misoprostol is a prostaglandin E1 analogue used to reduce the risk of NSAID-induced gastric ulcers and to terminate pregnancies. In this video, let's find what is misoprostol? What is misoprostol used for? Contraindication. What are the side effects of taking misoprostol? How does misoprostol work? How to use misoprostol? What is misoprostol? Misoprostol is a synthetic prostaglandin medication used to prevent and treat stomach and duodenal ulcers, induce labor, cause an abortion, and treat postpartum bleeding due to poor contraction of the uterus. Misoprostol was developed in 1973. It is on the World Health Organization's list of essential medicines. What is misoprostol used for? Misoprostol is indicated as a tablet to reduce the risk of NSAID-induced gastric ulcers, but not duodenal ulcers in high-risk patients. Misoprostol is also formulated in combination with diclofenac to treat symptoms of osteoarthritis or rheumatoid arthritis in patients with a high risk of developing gastric ulcers. Misoprostol is used off-label for the management of miscarriages, prevention of postpartum hemorrhage, and is also used alone or in combination with mifepristone in other countries for first trimester abortions. Contraindication. It is recommended that medical treatment for missed abortion with misoprostol should only be considered in people without the following contraindications: suspected ectopic pregnancy, use of nonsteroidal drugs, signs of pelvic infections or sepsis, unstable hemodynamics, known allergy to misoprostol, previous cesarean section, mitral stenosis, hypertension, glaucoma, bronchial asthma, and remote areas without a hospital nearby. Side effects. The most commonly reported adverse effect of taking misoprostol by mouth for the prevention of stomach ulcers is diarrhea. The next most commonly reported adverse effects of taking misoprostol by mouth for the prevention of gastric ulcers are abdominal pain, nausea, flatulence, headache, dyspepsia, vomiting, and constipation. There are increased side effects with sublingual or oral misoprostol, compared to a low dose, 400 mg, vaginal misoprostol. Pharmacodynamic. Misoprostol is a prostaglandin E1 analogue used to reduce the risk of NSAID-induced gastric ulcers by reducing secretion of gastric acid from parietal cells. Misoprostol is also used to manage miscarriages and used alone or in combination with mifepristone for first trimester abortion. An oral dose of misoprostol has an 8-minute onset of action and a duration of action of approximately 2 hours. A sublingual dose has an 11-minute onset of action and a duration of action of approximately 3 hours. A vaginal dose has a 20-minute onset of action and a duration of action of approximately 4 hours. And a rectal dose has a 100-minute onset of action and a duration of action of approximately 4 hours. Mechanism of action. Misoprostol is a synthetic prostaglandin E1 analogue that stimulates prostaglandin E1 receptors on parietal cells in the stomach to reduce gastric acid secretion. Mucus and bicarbonate secretion are also increased along with thickening of the mucosal bilayer so the mucosa can generate new cells. Misoprostol binds to smooth muscle cells in the uterine lining to increase the strength and frequency of contractions as well as degrade collagen and reduce cervical tone. Half-life. The half-life of an 800 g oral dose is 1.0401 plus or minus 0.5090 h. For a sublingual dose is 0.8542 plus or minus 0.1170 h. And for a buccal dose is 0.8365 plus or minus 0.1346 h. Dose. Usual adult dose for duodenal ulcer, 200 micrograms orally 4 times a day after meals and at bedtime. Maintenance dose, 100 to 200 micrograms orally 4 times a day. Usual adult dose for gastric ulcer, 200 micrograms orally 4 times a day after meals and at bedtime. Maintenance dose, 100 to 200 micrograms orally 4 times a day. Comment: treatment should be taken for the duration of nonsteroidal anti-inflammatory drug, NSAID, therapy. Usual adult dose for NSAID-induced ulcer prophylaxis, 200 micrograms orally 4 times after meals and at bedtime. Maintenance dose, 100 to 200 micrograms orally 4 times a day. Usual adult dose for labor induction or cervical ripening. American College of Obstetricians and Gynecologists, ACOG, recommendations, 25 micrograms vaginally every 3 to 6 hours. Some patients may require doses of 50 micrograms every 6 hours. Usual adult dose for postpartum bleeding, ACOG recommendations, 800 to 1000 micrograms rectally once. Use, management of postpartum hemorrhage. International Federation of Gynecology Obstetrics, FIGO, recommendations, 600 micrograms orally or 800 micrograms sublingually once immediately after delivery. Safety advice. It is in pregnancy category X, meaning that it is known to result in negative outcomes for the fetus if taken during pregnancy. That's all the information about misoprostol we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.